long does it last, Kamal? Like how many minutes? Okay, it's like
I think we are live, Dr. Ibrahim. So it's we are trying to keep it in less than 30 minutes.
okay.
So we are live, so we are going to start. Sorry, today we had to delay our start a little bit just because we are practicing surgery day to day, and then we do have unexpected days where the schedule may be different, schedule may be changing, and today is one of those days. While I'm saying this, I do want to make sure that I don't forget to introduce who we are. This is for Bariatric Surgery Program at American Surgery Center by CRIAS. CRIAS is Christiana Institute of Advanced Surgery. This is our volume 9 with the importance of weight management during the pandemic. And Dr. Irgao and Dr. Ibrahim were going to be my guests today. Dr. Irgao had to stay in the OR, so we are with Dr. Ibrahim. Dr. Ibrahim, I do want to start with you and introducing you. You joined our practice in 2017, and you are a board-certified bariatric surgeon. And if you can please give us a little bit more background on yourself, and then we'll start from there.
Thanks, Kamal, for the introduction. My name is George Ibrahim. I'm a board-certified general surgeon. After finishing my residency training in general surgery and getting my certification, I went on for a fellowship for minimally invasive surgery. And for our audience, that means minimal access, or in other terms, if you have someone or a friend who had surgery in the past and they have large scars, we do not do that kind of work anymore. What we do is very tailored to and technologically advanced, that we perform major procedures, so very small incisions or keyhole incisions. You might heard the term laparoscopic surgery or robotic surgery, and that's what we specialize in. That includes bariatric surgery, colon surgery, hernia surgery, gallbladder surgery, and other subspecialties as well. I've been in practice already for a few years. I moved to Delaware around 3 years now. I've been with the group here. And as you see, we are in fact a very large and versatile group of people. Starting from the left, Dr. Irgao, Dr. Wen, Dr. Peters, Dr. Singh, Dr. Vaid, myself, and our physician assistant, Mrs. Andrasik. And as you see, it's a large group of people, so we are always available 24/7 for our patients. And we all have different backgrounds and different experiences. So if any of our patients need a different thing, there will be always one of us specialized in that aspect. So we don't need to send any patient out for anything, to be honest with you.
Sure. So, Dr. Ibrahim, I do want to also introduce our dietitians and nutritionists. There are 3 of whom specialize in bariatric, Fran, Amy, and Beth. So they are part of our team. I do have this event on a weekly basis with our surgeons. So every once in a while, I do introduce different part of the team. Now, one of my questions for you is, so prior to you, we have 8 different sessions, and there was always this fine line that I was trying to be careful when we say we are the most experienced, because in some cases, experience can be by the duration of what we do, and also it can be with the new technology and new terms that we use, especially in medical world. So you do represent the new technology, new techniques in surgery for our group, as well as your experience. Can you tell me a little bit about how everything changed in time in terms of the surgical training?
Well, to be honest with you, I do consider myself lucky that I got the glimpse of both worlds. Transition happened slowly and gradually in the surgical world. So when I started my training, we were still during that transition. Like started from doing the open surgeries. Then, as the year progressed, the transition happened slowly from open surgery to laparoscopic to robotic. So that brings on table a lot, because when you go to seek surgical service or surgical advice, you need to meet a group of surgeons who are able to offer you all the options out there, not just able to offer you 1 or 2 options due to limited exposure or experience or training. And I think that's one great point of strength about our group, that we went through that transition, most all of us. So when any patient comes to us, we are able to offer all kind of options for them. It's not we can get asked, can I do this laparoscopic or robotic or open? And my answer can be, sorry, I cannot do that.
So that's really good to know. You know, one of the major times that we are going through with the pandemic, like really important issues in healthcare, the COVID-19 by itself is huge, but also how it's impacting everything else. Our initial reaction was, well, let's not do anything. And then we didn't do surgery for about 5 weeks. In fact, this is not just us, but throughout other states and other countries, they stopped doing the elective cases because we wanted to see how everything is going to work out. But then we realized later on, once we knew we were more in charge of the situation, we have to be able to bring our patients back. Now, the obesity already has its own, unfortunately, we have our own issues with some public opinion or medical opinion, whether or not this is a chronic disease. So, you know, as you know, like until 2010, we didn't have a diagnosis for this, but now we are actually taking obesity and connecting it for many of the other comorbidities. Now, we actually, our initial, again, after we went through the shock, we did say that, okay, well, let's see how we can actually do this safely, but also kind of fight that perception too in the meantime. Can you educate us a little bit on why patients should be going through this even we have the pandemic in place?
Well, for a starter, obesity itself is a pandemic. It was declared so by the World Health Organization many years ago. For a reason or another, it's not taking the attention it requires from the media and the health authorities. Unfortunately, that's the situation. But obesity is linked to so many health processes, from diabetes to hypertension to coronary artery disease, strokes, heart attacks, 13 different cancers. There is a lot of research and studies and even statements from National Institute of Health many years ago stating that obese individuals live shorter compared to non-obese individuals between 8 to 11 years. In New England Journal of Medicine just last month, a study came from Sweden proving that people who had bariatric surgery, for example, lived longer than people who did not treat their obesity at all. COVID-19, in fact, add more more gas to the fire or more fuel to the fire, because we know now that obese individuals who contract COVID-19 are more sicker than non-obese people. So ignoring the issue of obesity because we have a pandemic now does not get us anywhere, does not improve the issue with the pandemic. In fact, it adds more sick people to the pool. It will take years to get over this pandemic, to develop cures and treatments and vaccines. So in the meantime, what we can do to help is try to reach out to as much and as more to obese individuals and treat them. So at least, God forbid, and they get the disease, they are not at risk to end up in an ICU and a breathing machine for 3 or 4 weeks.
So I guess one of the, perhaps while we are processing these types of decisions, we do forget what actually we are going through. So our daily case conferences, so I actually, I'm part of those meetings, I chair those meetings. And the reason I'm saying that is because in terms of how much we do for the patient throughout this surgery, regardless of the pandemic or not, we still do what we are doing. So I do want to share, you may remember I did write about this issue. It was late last year. And one thing that I want our patient to remember is what you have to go through when you actually decide to go with this surgery anyway, right? So you have so many different checkpoints with different specialties. So I think that part is really important for everyone to really understand, because at a minimum, they get 3 different nutrition sessions. So they are with our nutritionists, and they get EGD for their endoscopy, and then they get their psychological clearance, which in this time of the pandemic, the psychological impact, regardless of you have obesity or not, it's so important. So then you get this checked. And then based on the situation, the cardio and pulmonary, and these issues are normally, you wouldn't actually go and check in with these specialties, but during the surgery process, is by default, you are already getting more people involved. So I think that management of that patient, clinical management of that patient is even at a greater level. And I was trying to kind of prep for this one, Dr. Ibrahim, and I'm like, okay, so how can we actually make this point so clear that, look, I mean, you do all these. Now, one may say, well, what about leaving their homes for these appointments? And we also know that telemedicine is the answer for that, which we do so many visits through telemedicine. Can you kind of, now, as I'm not a clinician, so when I say this, it may be different than if you are saying it. Like, do you agree with my assessment here with different specialists being involved with the surgical case anyway? And then, like, in my opinion, this makes the management a lot better for pandemic. So I don't know if I'm out of line there or not, but I'll leave that to you.
Well, I couldn't agree more with you about this. In fact, I mean, I'll rephrase what we're talking about here in different words. I mean, I get asked by the patient, is it safe to do surgery nowadays altogether? And the answer is absolutely. If my flesh and blood need this surgery, I wouldn't delay them because of the pandemic. Mm-hmm. We have all to realize that, in fact, bariatric surgery may be the most safe kind of procedure because, as you mentioned, patients go through many steps before you go to the surgery. You have to see many physicians, many appointments. All that is designed to make sure they are optimized, they are in the best shape for the procedure. So the outcomes has been great. The risk of complication is less than 1% nationwide. COVID-19, of course, is another matter to add to the table here. And about safety, we have been all now doing telemedicine and video conference with our patients. So the appointments, in fact, are becoming an easier load because they don't have to leave their houses. They can see all the healthcare professionals they need to see and talk to. Most of the times, by available technology, maybe if they need to go for a test or a blood test. But again, with people being careful, wearing their mask, maintaining social distancing, so the safety profile was not affected by that. Seeing all those other practitioners and all other specialty, in fact, add to the safety of the process.
So with the digital health, and in fact, we use the term integrated digital health in this case, integrated digital health platform. So one of the maybe new approach that we have is we said, okay, well, because we do telemedicine, perhaps there will be more support that's needed. And we actually increase the number of events that we are doing. And this is an example of these. And then we are actually focusing on certain topics as we discussed today, like why is getting the surgery, bariatric surgery during this time is safe. But anyone who actually wants to find out more about what we are doing, they can get it from our YouTube channels. These playlists are designed to make this easier to process. So with different surgeons actually talking about different topics. Now, going back to the issue of someone deciding the surgery, I just want to make sure that our message is clear. Because of the comorbidities, and or because if someone is tested positive, it may not be today, it may be 6 months from now, it may be 9 months from now. When someone is morbidly obese, that person is going to struggle with the recovery more than if they already lost 100 pounds prior to their testing positive. So that's what we are trying to kind of clear here, right, Dr. Ibrahim?
Absolutely agree with you. If anyone maintain their obesity and they get sick from any illness, and nowadays because of COVID-19, and their condition will be really critical. I mean, we all work on the hospitals. We talk to our medical counterparts. They struggle a lot with in the ICU patient with morbidly obese people because they require more medications, more fluids, more time on the breathing machines, and sometimes they are unable to disconnect them from ventilators. Then they require breathing tubes and feeding tubes to be placed temporarily because their rehabilitation might take weeks or months. Of course, non-obese individuals are at much less risk for these complications from COVID-19. So yes, I mean, again, the case speaks for itself here. Losing the weight will save you a lot of risks and complications down the line.
So, last week I had this episode with Dr. Wynn, and we discussed how actually the resolution of comorbidities after the surgery, and anywhere from 70 to 90% comorbidities are being resolved in the first 12 to 18 months of the surgery. So I think this is a good way to get ready for the times where it may be more difficult for other individuals, morbid obesity, people who struggle with the obesity. It may be a better preparation, especially with the pandemic. But regardless of the pandemic, this is the the most maybe satisfying part of what I do day to day, not the surgery, because I don't do surgeries, but I'm on the business side. But knowing that we are able to help our patients and seeing the results, because Dr. Ibrahim, like just so that we kind of cover this in different ways, once the patient is done with the surgery, the new term that we are trying to use is the wellness program after the surgery to keep them up to 5 years, initially every 3-4 months, and then after that once a year. Well, we see the results. Like the weight loss is one thing, but the comorbidity is extremely important to see the resolution of the comorbidity. So can you just give us the after surgery part of it, like what patient needs to go through so they can also hear it from you?
Well, after the surgery, of course, there's a lot of changes happening to lifestyle, eating habits, changes in what you eat, when you eat. Of course, there is a reduction on the portions of the meal, acquire new skills like learning how to count calories, how to figure out how much carbs in my meal, how much proteins, how much my body needs, how do I regulate my meals, how do I plan my meals in my day, my working day. Um, this could take us to a sidetrack. In fact, like sometimes I get consultation in the office and the question that gets handed to me, well, I'm working now from home and I notice I'm gaining weight. What should I do with that? And of course, I'm already getting the obesity because of all the medical problems. And I lost the weight before, had bariatric surgery, and my diabetes is gone, my high blood pressure, my sleep apnea. I don't want to go back there. So of course, COVID-19 implemented so many restrictions on us. You cannot go out as much as you want. Going to the gym is risky. I'm working from home, so I'm bored all the time, and I'm working from my kitchen. I raise my head, and the first thing I see is the fridge. It's becoming my best buddy now, or my best friend, and snacking is a problem. And after the surgery, there is few tips, and I think that's in fact one of the reasons we have that intense or robust follow-up. I mean, any other surgical specialty, you do your surgery, they see you 2 weeks out, and thank you, we shake hands, we're done. Or our relation extend to at least 5 years, and we would like even to extend it beyond that. The reason is because there's little troubleshooting, there's guidance, there's coaching, advices we get from time to time when we see deviation from the track. But right now, for people stuck at home, they feel stranded, they feel like they're struggling with a monster, and they don't know what to deal with it. So of course, there's so many things you can do at home. I mean, first of all, one of the, I think in my opinion, is the Achilles heel for weight gain when you are stuck at home, which is distraction. Meaning, say I'm doing my work on a computer and have a bag of snacks next to me. I'll take a bite, and I'm working, I'm taking a bite. That we call distraction, because you end up finishing large volume of food, taking too much calories without even you noticing I'm eating.
Yeah.
is like when you watch and binge watching a show on Netflix or Amazon, for example, and you finish a bag of snacks too. So one advice I give my patients: work is work, fun is fun, eating is eating. Don't mix any of that. For example, changing also the stuff you snack on or eat on. Focus on high fiber, high protein, high fat, low carb, for example. That resets your metabolism. Decrease the risk of fluctuation of sugar in your blood, which stimulates hunger. And the talk can go on for the next 2 hours about things you can do at home to avoid gaining weight or having issues. But again, I mean, of course, life after surgery, once you do the surgery and you start losing weight, you start reaping the benefits. And that's what I tell my patients. It's not about losing pounds. It's not about how you look in the mirror. It's about your quality of life, your health. Look to what happened to diabetes. I mean, I remember I had a patient with very bad diabetes getting almost 200 units of insulin a day, 6 weeks after sleep, for example, getting 0 units of insulin.
So, like with these 4 major comorbidities, like I think just so that we are going back to our original point of today's discussion, when we know that patients are able to resolve these problems 78 to 86% of the time, I'm sorry, 62 to 77% of the time, or 83% for the sleep apnea, which I think with the COVID, this is one of the major one. This is almost like, I'm thinking that how can we afford not doing this surgery if we have morbid obesity? So that's kind of like, I just want our patients to really understand this. And also the different things that we do, Dr. Ibrahim, in the surgery center with a number of, I sometimes call the surgery center the like kind of little Ritz-Carlton of the bariatric, because we have 2, maximum 3 cases. Patients do have one-on-one nurses until they are discharged. And the other thing is that how many people we are discharging on the same day. Right now, we are at 100% in the last 12 months. They are discharged on the same day. Patients are happy to go home after their case is done. And it's so really great to be part of this whole process and the bariatric surgery journey for our patients. Now, I know you saw patients all day long, and you were, in fact, today you were at the surgery center. And I say this because we are not, our job is not doing this program necessarily, but our job, you are a surgeon, I'm on the healthcare management side. So we do this so that we can actually reach out to the patients who may need the extra support. I'm taking the time away from them. Like today, in fact, the way that we couldn't get Dr. Irga on because he's doing an operation right now, someone was an add-on. And this is so important for us to have you guys available for these sessions, so that it makes it, for me, I enjoyed a lot personally, and I'm so grateful to be part of it. But if you have any closing comments, I would like to take those.
When it comes to the evolution of surgery, it is really astounding what we achieved in the last few years. But I'll quote, in fact, a talk I had with one of my mentors many years ago. And he was telling me about his memories. In fact, he was one of my mentors in a fellowship. So now he's practicing high technology surgery. And he was comparing that to his day one as an intern, many, many years ago, of course. And he was saying the worst call ever was Sunday call, because they had to admit all the patients the night before to do their history and physical, prepare them for surgeries, do the testing required. Next morning, Monday, surgery list is never ending, and patients staying in the hospital for a week. And the sad and funny part at the same time is the longer you stay in the hospital, the more you get sicker. You catch pneumonia, urinary tract infections, bed sores, blood clots in the legs. Now, we are moving to much shorter hospital stay. Now, we are not even going to a hospital. We go into outpatient centers. They are accredited, well-equipped, very safe environments. Staff is highly trained in the process. You're right about the ratio between the patient and the nurses is very adequate. In fact, most of the nurses in other hospitals and facilities are always complaining that the ratio is inadequate. I mean, a nurse has 6 patients.
Yeah.
She can attend all of them in one time, compared to one-to-one, for example, as we do in the outpatient center. So that's what I'm saying is the process now has changed much to the better, for sure.
Absolutely.
So I'm so happy with what we do.
Thank you. Dr. Ibrahim, again, thank you for your time. And I'm sure we'll do more sessions later on. I'm trying to get Dr. Sachin late for one of these sessions for the colorectal side, but I think we're going to do that in the next couple of weeks. We are trying to keep this time on Wednesdays, 3 p.m. Our regular time. We'll be back with another topic next week. We do have our United Medical ACO event tonight. That's the wellness webinar for the diabetes group. If you have diabetes, you should plan to attend that webinar. That's at 7 p.m. You can get the information on our YouTube and Facebook channels. And also Friday, we have an event for United Medical ACO again. It's more on the COVID-19 updates. We'll see you guys soon. Thank you so much.